Okay, we are live. Hello, everyone, and welcome to our Medicare webinar. My name is Hopwood, and of course, we're here with Pilat. We have a special guest, Brian Vincent from the Finlan Insurance Agency in Plymouth, Michigan. And Brian has been in this industry for over 10 years, and he handles all of our insurance needs as for the peak wealth management group health plan, and all of our clients who are 65, we send them over to Brian for Medicare. So I want to remind everyone that when you're setting up Medicare, your agent works for you basically for free, whether you're calling 1-800-XYZ insurance company or working through Brian, you pay the same price. So having an expert like Brian in your corner is really important, and it's a really nice value add. Brian, we're going to be going over some case studies with myself and Jim, and you're going to be, my agent working for me, showing me what a good option for Medicare would be. Okay, you ready for that?
Absolutely. Thanks for having me, Nick and Jim.
You betcha. So who wants to go first? Jim, do you want to go first, or should I go first?
I'm ready to go.
All right, go ahead.
So, Brian, so here I am. I'm turning 65. My coworkers are telling me, make sure you do the Medicare. So I'm really green, right? I don't know one thing from the other. So wanted to see, what that process would look like. I reach out to you and say, hey, Brian, Nick, and Jim recommended I call you. What do I need to know?
Hey, Jim. So the first thing I would tell you is that it's entirely dependent on somebody's own individual circumstances, but we'll assume that for purposes of our hypothetical, you're turning 65 in December. We'll just say on Christmas, December 25th.
Okay.
What's that?
Yeah, sounds good.
Yeah. The first thing you're going to need to do is enroll in what's called Medicare Part A and Medicare Part B. And there are three ways to enroll in Medicare Part A and Medicare Part B. The first of which is, in my opinion, the easiest. That's online. So you can go on to actually ssn.gov, the Social Security website. I believe it SSN or SSI.gov, and do it that way. And that takes about 5 minutes. If you are already receiving Social Security before you turn 65, it's even easier than that, but we'll assume for our purposes that you're not. So the first way is online. The second way would be normally in person at your local Social Security office. That's not an available option right now because of COVID. Mm-hmm. And then the third way would be you can call in. You can call a 1-800 number. So those are the three ways to enroll in your Part A and Part B. Your Part A is hospital coverage. Part B is doctor coverage. And together, that's what's known as Original Medicare. So Medicare Parts A and B are synonymous with Original Medicare. Part A, assuming you've worked a sufficient amount of time, is going to be free. There's no premium for Part A. Part B has a premium, and for 2020, the default premium is $144.60, so $144.60 each month. And if you make over a certain amount of money, around $77,000 for an individual, or for a couple filing jointly, I want to say it's around $177,000. If you make above either of those thresholds, then you're going to pay extra. They penalize you, but it starts at $144.60. And if you just kept your Part A and Part B and did nothing else, the coverage would start on the first of the month when you turn 65. So for you turn 65 on Christmas of this year. Your coverage would start December 1st. And again, if we add nothing else to that Part A and Part B or Original Medicare, the setup would be you pay 20%, the government pays 80%. So a 20-80 cost share. But that is option one. And in my opinion, it's not the best option because you can add to that coverage for, in certain circumstances, no extra money. But that would be option one. And that's also the prerequisite to enroll in an additional Medicare option. So it's your ticket to play.
And it's required that I do that, correct?
Correct. Yep. In order to purchase an additional insurance option, which would be like a Medicare supplement, synonymous with a Medigap, and a Part D prescription drug card, you have to have your Part A and Part B. So enrolling in Part A and Part B is the very first step you want to take if you're just about to turn 65 or you're becoming eligible for Medicare for the first time. Yeah, that's the ticket to play.
And and how long before I turn 65 should I be going through the process of enrolling?
About 3 months. The earlier the better. It takes about 2 weeks for the federal government. Center for Medicaid and Medicare Services, CMS, is the department that handles this. And it takes them about 2 weeks to turn it around from the time you apply to when you actually get your assigned Medicare ID number and card.
Okay. And do I just pay that $144 for Part B? Do I just write a check for that, or how does that get paid?
It can be paid in any number of ways. The $144.60, if you're already receiving Social Security, can come directly out of your Social Security check. If you're not, you can get a bill in the mail and send in a check each month. You can send it in quarterly, or I believe you can pay with a checking account. I believe you can pay with a credit card even now, but you can pay however you'd like.
Okay.
So from there, we would be left with, okay, do we keep original Medicare or do we want to add something else? And I would suggest that adding something else is going to be a good idea for everybody. So option two, if we look at option one as being original Medicare, the Part A and Part B, 80-20, option two would be what's called a Medicare Advantage prescription drug plan, otherwise known as a Part C. And a Medicare Advantage prescription drug plan acts as an umbrella that goes over the top of your Part A and Part B, original Medicare, that doctor and hospital coverage, and it wraps in your Part D, which is prescription drugs, into a nice, neat package with some additional frills and benefits on the side, such as with a lot of plans, maybe a gym membership or dental and vision coverage, for example. A Medicare Advantage prescription drug plan can have a premium in addition to $144.60, but there are quite a few options with quite a few companies that are zero cost, so $0 in addition to the $144.60 that you pay for Part B. A Medicare Advantage prescription drug plan is going to look a lot more like an employer-sponsored plan or an individual under 65 plan, and that you're going to pay a copay with most plans if you go to the doctor's office, if you go to a specialist, if you go to the emergency room, urgent care, and they're going to have maybe a deductible, maybe not, for the health portion of it, and also for the prescription drug portion of it. But you would essentially have one company, one private insurance company's card that you would use as your medical card and provide that to doctors, hospitals, and pharmacies.
Are there a lot of companies that can provide those type of policies?
Yeah, there are a ton of companies. It's state by state for the most part. And in Michigan, I would say we have definitely more than 10. You've probably heard of most of them, but it's a very competitive marketplace. So that's a good thing for the consumer. The goal is to try and pick a plan that fits your needs the best. And your needs would be, how often you're going to use it, what doctors and hospitals would you like to have in your network, and what prescription drugs do you take. And we would like to pick a plan that leaves us with a custom fit, lowest estimated out of pocket for the year being kind of the guideline. The more efficient the plan uses the dollars that are given to them, the better.
Hey, Brian, Brian, you mentioned a second ago that the state of Michigan, but there are people who are on the webinar and we're recording it for future use that are out of state, like people in Florida, people in Ohio. You know, are you able to help those folks as their Medicare agent?
We're licensed in quite a few states, so it would be, you know, a person by person thing, but we have referral partners in every state that we could certainly send somebody to and recommend this person as somebody who will take care of them.
Great.
So Brian, if there's all these different plans to choose from, and I know there's, you know, assessing your health situation, you know, if I'm a healthy individual, how do I know that I'm getting the best bang for my buck or the right plan for me?
Based on a couple different things, you know, there are different plan levels available. So if we just back up for a second, the federal government, based upon all of the money that we as working people pay into Medicare over the course of our career, the federal government provides any of these companies, and I'll just name a few like Blue Cross, HAP, Priority Health, United Healthcare. The federal government will provide a certain amount of money each month on behalf of each Medicare beneficiary, you, Jim. That bucket of money is a pretty big bucket, and that allows these companies to offer plans for no cost. Certain plans will have a cost, certain plans won't have a cost, but based on how efficiently those companies use the money, they get star ratings. So we can take a look at the star ratings of the different companies that are out there. And stars are attributed to several things. One is the efficiency with which they use the bucket of money that the federal government gives the company. Customer service factors into it. There are several different factors, but that's one of the things we look at. But even more importantly, I'd say we want to custom fit the plan to you based on your travel needs, your actual health needs. And one of the biggest value adds that we can bring to the table is looking at any prescription drugs that you take, running it through an online system that's available actually through the federal government, and picking a plan based on the lowest estimated out-of-pocket for your prescription drugs. So there are a lot of factors that come into play, but the goal in the end is, you know, picking the most cost-effective option.
And that's what you would help me do, right?
Yeah, that's what we help you do. Yep.
Okay, good.
Yep. So we've talked about original Medicare, option 1, the Part A and B. We've talked about Medicare Advantage prescription drug plans, which would be option 2. The third option, which some people might refer to as the Cadillac option, would be a Medicare supplement, which is synonymous with a Medigap plan. And then on top of that, a separate prescription drug card, a Part D standalone prescription drug card. And the way option 3 would work is with original Medicare, the Part A and Part B, we've got the government paying 80% of your doctor and hospital bills. You're left with 20%. The Medigap or Medicare supplement plan, option 3, would plug that 20% gap so that you're left with, in most cases, no out-of-pockets. So there are different options within a Medicare supplement, and they're identified by letters, so it makes it even more confusing. But for example, one of them might be a Plan G or a Plan N. But just generally speaking, the Medicare supplement is going to be underwritten by a private company, and it's going to plug that 20% gap so that when you go to the doctor or hospital and show that company medical card, you know, Medicare supplement through Blue Cross or HAP or Priority Health or United Healthcare or Aetna or Cigna, you're going to be left with no out-of-pocket. So if you go to the doctor, you don't pay a dime. If you go to the urgent care, you don't pay anything. If you have a inpatient hospitalization, you're not going to pay anything up until a certain point. Outpatient, same thing. The only portion of your medical needs that are not covered by the supplement would be your prescription drugs. So with a Medicare supplement, you would purchase that from one private company, and then we would run an analysis like we did with the Medicare Advantage plan with your standalone prescription drug Part D, and try and pick a standalone prescription drug card that best fits your needs, the one that leaves you with the lowest annual cost.
Okay, excellent.
Yep. I guess I would mention a couple more things. The first is that unlike with a Medicare Advantage plan, where you can enroll when you're first eligible, and then each year after that, you can make changes, and we highly recommend that you do make changes, or at least review your options, because plans change, your needs change, prescription drugs change. So during each year's open enrollment period, which is always October 15th through December 7th, so we're right in the middle of it right now, you can make changes to your Medicare Advantage plan or a standalone prescription drug plan, and there are no pre-existing limitations or any underwriting. Option 3 is totally different. With a Medicare supplement, you have one chance at getting into the plan at the very best rates, and if you do that, you're locked in for life. You can keep that plan forever. The caveat to that is if you do not enroll when you're initially eligible, so say you initially take a Medicare Advantage plan or just stay with original Medicare Part A and B, and at some point down the road you decide you'd like to enroll in a Medicare supplement or Medigap plan, you are going to have to answer medical questions. There will be underwriting. And based on your answers to those questions, you might receive a higher premium rate, or you could be rejected. They might decline to bring you on. So there's, I guess that consideration is unique to the Medicare supplement, but there's pros and cons to both. It's like any insurance with the MAPD option 2 Medicare Advantage plan. You're going to have some more out-of-pockets, but there's no additional premium or very little additional premium above and beyond the Part B $144.60. With the Medicare supplement, there is a premium for a 65-year-old man or woman. It's going to range anywhere from say $120 to maybe $150 a month, and it's based on your sex and your geography for the most part. But you're going to get whatever the company's very best rate is if you initially enroll in that plan, because you're guaranteed to get in at the best class. So those are kind of the options that are out there, and each person is different. So we look at each person's situation and try and custom fit the best options for them.
So, yeah, so that was a really important thing. So if I want to make sure I have good health coverage and with the Medigap and everything, that's something you need to pay attention to right out of the gate at 65, huh?
Yeah, I mean, like I said, everybody's situation is different, but especially if you or any individual has had some major health issues, then it's something to consider.
Okay.
So Brian, I'll be 65 in December as well, and I have some health challenges. I just was diagnosed with cancer, but I think I'm good. Okay, I think that I've got an all clear signal, but I've got some drugs that I have to take still. Let's see if I can pronounce these. Amlodipine, and
Amlodipine. I think it's pronounced amlodipine, but yep.
Okay, amlodipine.
Your dosage and frequency?
5 milligrams one time a day, and then also metoprolol, 25 megs twice a day. So my situation is a little bit different than Jim. Can you recommend, a strategy for Medicare based on my situation?
Yeah, absolutely. So I'm sorry to hear you've had some medical issues. When it comes to meeting with somebody, whether they have medical issues or not. If they take any prescription drugs, we like to try and collect a list of those drugs beforehand, as well as a list of any providers that they see. So any doctors, hospitals, everybody who they may have seen in the past and may see in the future. And based on those prescription drugs and those providers and any medical needs they've had, we can make a recommendation. But the first step with analyzing the prescription drugs, at least in our office, is to go and log on to, or you don't even have to log on to, you can just use the Center for Medicare and Medicaid Services own proprietary prescription drug tool, where you can enter in prescription drugs, and based on those prescription drugs, it will spit out a list of the most to least cost-effective MAPD Medicare Advantage plans or standalone prescription drug plans available. So it's truly a customized tool, and it's really nice because it's provided for free. So I'm going to try and share my screen and do that right now. Let's see. Can everybody see that?
Yes.
Yep.
Okay. So the website to do this is Medicare.gov, and you're just going to want to do /plan-compare and then another / and if a Medicare beneficiary actually has his or her Medicare ID number already, using that information together with a couple other key pieces of information, I believe a birthday and an email, you can actually create an account. And by creating an account, Medicare.gov will remember the prescriptions that you put in and any plans that you currently have, and use those so that you don't have to reinvent the wheel and go back each year and re-enter your prescription drugs. You can just kind of work with the list that you have and update it as you need to, take them off, add them, and it'll also use your plan so you can compare your actual Medicare Advantage or prescription drug plan with all the other plans that are out there in terms of cost effectiveness. So for our purposes, I'm not going to create an account. I'm just going to go in using that. There's a little button at the top that allows you to log in or continue without logging in. So that's what I did first. And then I selected that I want to compare standalone prescription drug plans, Part D. So it brought me to this screen, and I'm going to enter Nick's first drug in. So we put that in. What milligram dosage?
5 milligrams once per day.
Okay. So we're going to add that. And then we're going to add the second one.
Metoprolol.
What was the dosage on that one?
25 twice a day.
Okay. So we're all done adding them. It'll give you the option to pick any retail pharmacy that you'd like to visit. It'll also give you the option by default to use a mail order pharmacy. And just generally speaking, all of the different companies that offer Medicare Advantage plans and standalone prescription drug plans really push mail order these days. So you can, if you're willing to go that route, save a good chunk of change. But for our purposes here, we'll do the mail order, and then I'll just add in a couple of the ones that I see first. So a CVS, and then put in the Meyer. So based on those inputs, it allows you to sort them by different criteria. The default criteria is lowest drug plus premium cost. and that's the one that we would use. That gives us an idea of what the total exposure for this plan will be, including the premium that you pay each month and any out-of-pockets, deductibles, copays, etc. So based on NIC's 2 prescription drugs, this system's recommending the Silver Script plan. Next would be a WellCare, and so on and so forth. So that's the tool that we would utilize to pick a standalone prescription drug plan that best fits NIC's needs. I'm going to stop sharing my screen now.
That's not too expensive. That's pretty good.
Yeah. Plans, when it comes to a prescription drug plan, a standalone or a Medicare Advantage plan in the drug coverage portion of it, they generally have 2 different formats. One is the plan will have no deductible. So you just start paying flat fee copays right away based on the tier that the drug is. So each plan has a formulary and it tiers all of the different prescription drugs that are out there. The second format would be there's a deductible, maybe say a $440 prescription drug deductible. So you pay the first $440 and then there's copays after that. And the lower premium plans generally will have a deductible. The higher premium plans will not. So for example, this Silver Script plan has a $6.90 monthly premium and a $445 drug deductible. And the plan estimates, this system estimates that this plan will cost NIC all in, so including the monthly premiums, $82.80 for the whole year. Pretty good.
Yeah, that's amazing. And since I'm just turning 65 and I have some health considerations, I think I heard you tell Jim that I can get into a plan without having any health questions or any concerns. But if I wait, then I'll have to disclose all my information at a later time, and I could be facing larger premiums, right?
Yeah. So again, you would have 3 options, and the nice thing about Medicare is that there really is no bad option. The coverage is going to be great across the board, but if you had a recent issue, so if you were diagnosed with cancer within the past 2 years, let's say, even if you are in remission right now, that would be a important thing to consider. So if you went with option 1 going forward, your original Medicare would cover 80%, you'd cover 20%. The Medicare Advantage would be option 2. You'd be left with quite a few out-of-pockets, but still a pretty low annual out-of-pocket max. So it's still a good option relative to everything else that's out there for people under 65 or employer-sponsored stuff. But then option 3, I would really urge you to take a look at, because even though you've been diagnosed with cancer within the past 2 years, you have the opportunity to get into a Medicare supplement or Medigap plan, option 3, which will leave you with nearly no out-of-pockets. And you can get in at the very best rate class with absolutely no underwriting. They call that your guarantee issue right. And you're locked in for life. They can't kick you out. So, I think it would be worthwhile to consider taking advantage of that. Because if you decided down the road, either when something came up, you're cancer-free for a number of years, so you go with a Medicare Advantage plan, but then say in 4 or 5 years, the cancer comes back, you would probably not be able to switch into a Medicare supplement at that point. Or if you did switch, it would be at higher rates. Because again, you only get one shot at getting in with no underwriting. After that, you're going to have to answer medical questions. And based on those answers, so if you say yes to one or more questions, you could either receive higher rates or you could be rejected totally.
All right, we're about out of time, but we do have 3 easy questions for Brian. First one is, what if I have full VA coverage? Do I apply for Medicare?
So with a VA prescription drug coverage, we have quite a few clients who also enroll in a Medicare Advantage plan. So you can use either coverage. If you're in a Medicare Advantage prescription drug plan, you can use either the Medicare Advantage prescription drug plans, drug coverage, or your VA coverage. It's up to you. A lot of people like the convenience of not having to go to Ann Arbor or wherever your local VA might be. But you can price it out. You're in a pretty unique position where you've got two options. So if you have some more expensive drugs, you can price it out both ways.
Thank you. The second question is, for option 2, does that premium come out of my Social Security check as well?
It can, yeah, you can, for all of these different premiums, if your option 2 does have a premium, because again, a lot of the Medicare Advantage plans will not have one. It'll be a $0 plan. But if it does, and you're receiving Social Security, you can have them deduct it and take it out of your Social Security check, or you can get a bill in the mail, or you can pay with automatic checking.
The third question is, what if I don't have any prescriptions? And I think that was the case study that you were reviewing with Jim, right?
Yeah, that makes it easier. In my opinion, going with a plan that has a great star rating and just uses money more efficiently than other plans based upon your provider needs and network needs is much easier than when we involve prescription drugs. So anybody who comes to us with no prescription drugs, generally speaking, during any given year, we're going to have a number of plans that we've identified as being great fits for people with no prescription drugs. It might be a PPO plan that goes all the way across the United States, or an HMO plan that's more regional, but it makes it much easier for us when there are no prescription drugs, because that's not a component. I will say that even if you take no prescription drugs, we always recommend that you enroll in either a Medicare Advantage plan that has prescription drugs, or if you go the supplement route, a standalone prescription drug card, because you will be penalized later on down the road when you do need prescription drug coverage if you don't take prescription drug coverage right away. So you want to take Part D from the date that you're initially eligible. Otherwise, you'll be penalized based on the amount of time that you go without it when you ultimately do need it.
And lastly, if we want to learn more from Brian, we did a podcast November of 2019 talking about disability and Medicare. So you can go ahead and double back to that on the Retire with Confidence podcast. But if we want to learn more, what's your website and how can we contact you via email or phone?
Yeah, sure. So I am an agent at Finlan Insurance in Plymouth. We've been around for more than 100 years. Our office is right off of M14 and the Beck Road exit. So you can always, our office is a little buttoned down like most right now, but normally you could stop by and see me. Our website is www.finland.com. It's like the country Finland, but with no D. So F as in Frank, I, N as in Nancy, L, A, N as in Nancy. So
all lowercase, right?
What's that?
All lowercase, right?
Whatever works.
Okay.
And you can also call me anytime. I'll even give out my cell phone. My cell phone is 248-320-3920.
Okay. Thanks, Brian. This is going to be recorded. It'll be posted on YouTube as well as the audio only on the Retire with Confidence podcast. We want to thank you for sharing your expertise, and hopefully if any of our clients need help, they'll reach out to you.
Thanks, Nick. Thanks, Jim.
Thanks, Brian.
Thank you. All right, everyone. Have a great day.